Kidney transplant, a comprehensive guide. This video is created by Dr. Aman Gupta, a kidney transplant surgeon in New Delhi, India. What is a kidney transplant? A kidney transplant is a surgical procedure where a healthy kidney from a donor is placed in a person whose kidneys have failed. It is considered the best treatment for end-stage renal disease compared to dialysis, as it offers a better quality of life and longer survival. Who needs a kidney transplant? A kidney transplant is needed for people with chronic kidney disease stage 5 or end-stage renal disease. By this stage, kidneys are permanently failed and can no longer filter the blood and remove toxins from the body. Who performs kidney transplant? The surgery is performed by a urologist who has undergone training to do so. It is a teamwork where pre-operative and post-operative support is provided by a nephrologist and other teams. What are the treatment options once kidneys fail? Only two options: lifelong dialysis, which is generally required 2 to 3 times a week, or a kidney transplant. Why is kidney transplant better than dialysis? Kidney transplant is the best long-term option. A kidney transplant provides better survival, more freedom and energy, fewer diet restrictions, lower long-term cost, and better overall health. How is kidney transplant surgery performed? The surgery is a 3 to 4 hours procedure under general anesthesia. You are asleep during the surgery and will not feel any pain. We take the donor and recipient simultaneously in different operation theaters. A cut is made in the lower abdomen, near the pelvis. The donor kidney is placed in the lower abdomen, and blood vessels are connected to your arteries and veins. The new kidney's ureter is connected to your bladder. The incision is closed with stitches or staples. Your old diseased kidneys are usually not removed unless they are causing problems like infections or high blood pressure. What to expect after the surgery? Once you are awake and out of anesthesia, you are kept in an isolation ICU where your health and kidney is constantly monitored. You will notice some tubes in your body. One is in the side of the neck for intravenous fluids and pressure monitoring. One is in the urinary passage called a Foley's catheter. One is in the site of operation. This is called a drain and allows the blood and fluid collected in the abdomen after surgery to come out. There is another invisible tube inside the kidney. This is called a DJ stent. This helps in healing of the stitches of the bladder and ureter. When are these tubes removed? Most of the external tubes are removed after 5 days. Rarely need to keep longer based on medical conditions. The internal tube called stent is removed after 3 weeks by passing a thin camera into the urine passage. It's a small 5-minute procedure done under local anesthesia and is done as a daycare procedure. When are you allowed food after the surgery? You have to remain fasting on the day of surgery. Next morning, you are allowed a liquid diet, and the day or two after, you are allowed solid food. When can you walk and take a bath? Once the external tubes are out, you are allowed to walk and take a bath. When are you discharged from the hospital? Generally after 7 to 10 days, once kidney function and general medical condition is stabilized and tubes are out. Sometimes you may need to stay longer in case the kidney function recovery is slow. When are the stitches removed? Stitches are removed after 3 weeks, generally at the time of stent removal. When can you travel back to your city or country? After 4 to 6 weeks once your kidney function is stable and your medications are adjusted well. When can you resume work or exercise? After 3 months of surgery. Initial 3 months the immunity is low and it's better to avoid crowded places. Also by this time wounds are completely healed. When does the new kidney start functioning? 80% of the kidneys start functioning immediately after the surgery, and urine production starts immediately during the surgery. 20% kidneys are slow, but generally recover in few days. However, 1 to 2% kidneys do not function at all and undergo rejection. In some such cases, the rejected kidney may require removal as it may become a source of infection. If the kidney function is slow, the nephrologist will modify the medications or perform a kidney biopsy. During biopsy, a needle is passed in kidney to collect a small piece of tissue from kidney and examined under microscope. Based on the findings, your medicines may be modified. Sometimes when the kidney function is slow during the recovery process, you may need a few sessions of dialysis till kidney recovers. What are the complications after kidney transplant? Two main complications are infection and rejection. What is rejection? In simple terms, your body is trying to fight the new kidney as it doesn't see it as a part of its own system and body. Your body continuously tries to fight it. You are given some medications called immunosuppressants for the rest of your life to avoid this fight or rejection. However, one day the body wins this fight against the kidney, and the kidney is rejection. This may happen in a few days, or this may happen after 30 years. It varies widely from individual to individual and is dependent on many factors. Infection is the other main complication. Because of these anti-rejection medications or immunosuppressants, the immunity of body goes down. As a result, you are more prone to infections. These infections can harm you or the kidney. What can you do to prevent infection or rejection? To prevent infections, maintain good hygiene. Eat hygienic and well-cooked food. Avoid dining at unhygienic places when you're traveling. Wash raw fruits and vegetables thoroughly before eating. Avoid raw meat products. Drink clean and filtered drinking water. Avoid smoking, tobacco and alcohol. Wear a mask when in crowded places. Don't consider any infection as minor. Always get in touch with your doctor and don't self-medicate. To reduce chances of rejection, take medication as prescribed and never stop them on your own, even if you feel that you are in perfect health. Maintain a healthy lifestyle. Follow up with your transplant team regularly for necessary checkups. What are the complications of surgery? Sometimes there can be some internal bleeding at the surgery site. Generally, it happens in the first 24 to 48 hours. In this situation, we take you back to the operation theatre, open the wound, and control the bleeding. Sometimes there can be infection of the wound as your immunity is low. Very rare complications are clot in the vessels of the kidney, which may necessitate removal of the kidney. Sometimes when the kidney gets completely rejected, we may need to remove the kidney as it may become a source of infection. What medicine do you need to take after surgery? The medicine called immunosuppressants or anti-rejection medicines have to be taken for the rest of your life till the kidney is functioning. The initial 6 months, the dose is high but reduced after 6 months. Apart from these, some antifungals, antivirals, antibiotics, blood pressure or sugar medications may continue based on individual medical conditions. What are the success rates of kidney transplant? At the end of 1 month, 97 to 98% kidneys recover. At the end of 1 year, 90% kidneys continue to work well. How long will the new kidney function? The new kidney has an average life of 15 years. It can be more than that, or it can be much less than that. It depends on how well you look after your own health, take necessary precautions, and follow medicines properly. However, in spite of whatever you do, at some point in life, the body rejects the kidney. This may happen in a few weeks to months, or even after 25 to 30 years. What can be done once the new kidney stops functioning or gets rejected? You can be on dialysis again, or can choose to undergo a second or even third transplant. If you found this video useful or informative, Don't forget to share it with someone else who is planning or has undergone a kidney transplant. For more information on kidney transplant, subscribe to my channel or book an appointment with Dr. Aman Gupta, a kidney transplant surgeon at 844-885-7369.